morning, Senator. Very nice to see you. You've been a real leader in this issue and many others. Grateful. We wanted to bring people together and talk about a very pressing issue that faces West Virginia, and that's obviously the state of our child welfare system. Now, as has been widely reported, this has been an issue that's plagued the state for a very, very long time. And in the past, we've talked about the fact that the state has failed a lot of the children that are in the care of the state. To me, that's unacceptable, and that's why we've been diligently working over the last year to try to make some improvements. And so I think we're making progress, but I want to give you that update and show you where we stand and also some other initiatives that I think could go even further today. Now, one of the major problems we have faced and we've seen is the fact that there are a lot of kids that are out of state. I believe that's a terrible problem, and I think we need to fix it. And so we've been working on that. I'm going to talk about some of the solutions in a moment. But we need to bring our kids home. And we want to keep our kids close to our families and to our communities whenever it's safe to do so, right? This has to be a goal of our administration and the legislature. I think it is. We owe it to our kids to fix the many deficiencies within the CPS system. So today, we want to highlight some of the efforts ongoing through our Department of Human Services and our Secretary, Alex Mayer, on ways that we're trying to make things more accountable, more effective, more efficient, ultimately to lead to better results for our kids, because that ultimately is what matters. Now, back in May, we came before you and we talked about 6 sweeping reforms that were taking place within the child welfare system that were meant to improve transparency and to improve results. I said then, these aren't always the sexiest issues to talk about. You have to get the fundamentals right, and that's what we've been working on over the last 6 months. Some of the reforms that we talked about earlier in the year, including fully complying with the Child Abuse Prevention and Treatment Act. That's important. Some of the federal guidelines requiring public disclosure of key information in child abuse or neglect cases. Overhauling the child welfare dashboard to provide more transparency to people. Requiring supervisors to conduct monthly reviews with their child welfare cases. It's so important that there's a management function that's tying in what the line level staff are working on and reviewing progress on a regular basis. And that LEAD initiative was designed to better prepare our supervisors. We think that's making progress. Also, we know through some of the problems of the past, it was important to create a critical incident review team so you could conduct deeper dives into some of the more complex issues that were out there. There's also a lot of discussion and work ongoing in a comprehensive practice model to provide a broader framework that can be standardized across the state and have key learnings from some of the tough situations that are occurring. And of course, also allowing caseworkers to gather more comprehensive information on cases than relying solely on the referral. These are critical steps, and they are making things better. A lot more work, though, needs to be done. And ultimately, we have to make sure that we're taking care of the kids in our state in the best manner possible. So a couple key numbers that I wanted to throw out to you. We've seen some changes. First, I want to note that this year, we've reduced the CPS backlog by over 50% statewide. That's, based on the department information, the largest improvement we've seen in 5 years. Then we know that we're looking at the child placement issues, and we're going to get back to you on that, but over the child placement issues, just over the last year alone, we've seen the number of children in placement drop, going from 6,148 to a little bit under 6,000 now. Now, we need to drop that number a lot more. I think that's critical, but we want to make progress in terms of ensuring that our kids are in the right places, and we think it's a positive sign when these numbers go down. Fewer removals of kids, averaging 365 monthly removals in 2024. to 324 monthly removals in 25. Modest changes, but very good. Also, importantly, substance use-related removals have been reduced by 37%, and that's the lowest level since 2007. The reason that's so important is because substance abuse has been one of the key causes plaguing the disruption of our family unit. And I know that there are broader statistics showing that the state's been making improvement on substance abuse. Well, that flows through to the foster care and the child welfare system as well. We also know that there were 1,100 adoptions completed this year, so we think that's very positive. We're going to try to get to you some of the past history of what that means compared to past years, but we're told that it's one of the highest totals on record. Now, these are good statistics, but we shouldn't be beating our chest. We have a lot more work to do, and I know that, and we all know that. One area that we've talked to Human Services about is also improving how we're managing this program and others. And I know Secretary has been fully focused in terms of ways to bring more cost efficiencies to the program. And I can tell you that in November alone, a lot of that focus helped reduce over $300,000 in improper payments. That's positive. These are some of the residential placements. We're scrutinizing things more closely. I think it's going to make a big, big difference. There are also other tools that Human Services is putting out there. There's the COMET tool, the Communications Operations Mobile Engagement tool, which is designed to increase communications and collaboration around the state. So there's some good programs that folks have been working on hard over the last year to facilitate collaboration. So foster carers, caseworkers, attorneys, service providers, and other individuals can share information and track updates. We think all of that's important because good policy cannot occur without good communication between all the relevant people. So we have made progress, but there's more work that needs to be done. And we know that there are initiatives that we'll be talking about coming out in the near future related to kinship care, expanding crisis services, and having community-based alternatives, utilizing faith-based initiatives. All those are coming. We'll be talking more about that soon. But today, we want to really focus on something that I think tugs at the heartstrings of so many West Virginians. You see, for many, many, many years, West Virginia's been sending too many of our kids out of state to receive care that they should get right here at home. These placements are very costly, and they separate children from their families, their communities, and ultimately it can lead to longer stays. We have to be looking for ways to change that. That's why one of my major priorities has been to help bring them home. And so we've been working on that and various ideas to expand in-state treatment capacity and then reinvest those savings from some of the fewer out-of-state placements back in so we have better capacity in our state for the future. We're looking to ensure that we're going to improve care, strengthen our families, but also be very mindful of taxpayer dollars. That's why today I'm pleased to announce that it's our intent to work with the legislature this year on a bill to establish a framework for reducing those out-of-state placements. Right now, there's some numbers that we're seeing, about 380 on the out-of-state side. I'm told they average about 156,000 or so. Forgive me if the numbers change from time to time. But we need to make sure we get those numbers down. And without talking about specific facilities, I can tell you what we want to do is we want to create a new revolving investment fund in order to make sure we're building out some of the existing state-owned facilities and that those dollars are going to be used to renovate and repair existing state properties by providing high acuity psychiatric, neurodevelopmental, and trauma services for kids in West Virginia. We're also going to be furthering treatment programs that match the clinical profiles of our kids. And what the goal is to take that revolving fund, as you put money in to refurbish the facilities and you bring people home, we think we can actually save money as a result, and then we can reinvest it back into the program with the goal of eventually eliminating out-of-state placements. I'm not here to give you a date on that, but we want to do that. That needs to be our goal, and we need to be very aggressive about that. As you have reductions in those out-of-state placements, that's more money for investment here in West Virginia. It allows us to build up that workforce capacity. This is important, and I think it demonstrates a willingness of our effort, work with the legislature and others who know about the challenges that affect our CPS and our foster care system. The system's far from perfect, but we do know we're making progress, and it's stronger than where it was just 1 year ago. I think through disciplined leadership, community partnership, and making decisions based on data, we have the ability to continue to reduce removals, to stabilize placements, and to strengthen the fiscal integrity of all of these programs. Now, these aren't quick fixes. They're not cosmetic changes. I said this is not something that's going to occur overnight, but we're making meaningful progress for our kids, and we're going to keep going, and we'll keep reporting back to you from time to time. But we want to go further, and that's why I'm so excited to announce that we're eager to work with the legislature on that revolving fund to invest in it, because you've all read some of the articles that have been out there, and we want to make sure that we're addressing those issues to make sure that we're putting money into our in-state facilities, and we think that could be a cost-effective part of the solution. So I'm thrilled about that, and we're making real progress. So with that, what I'd like to do is turn the mic over to Secretary Alex Mayer, who will also have some remarks. Thank you. Thank you, sir.
Thank you. Well, good morning, everyone. I want to thank the governor for the opportunity to speak today. We are hard at work, and there's a lot of great team members around the state working diligently on this effort. When we talk about progress in West Virginia's child welfare system, it's essential to be clear what we mean about that. Progress does not mean the work is finished. It does not mean that the system is perfect, and it certainly does not mean the challenges facing children and families and frontline staff have disappeared. What this progress does mean is that we have begun to lay a foundation strong enough to support sustained change that can now accelerate at an exponential rate. For many years, the child welfare system experienced long periods of limited movement. Leadership shifted, initiatives were introduced, and new ideas were discussed. But the underlying infrastructure of practice, data, and workforce supports remain essentially unchanged. Without this foundation, even well-intentioned reforms struggle to take hold and make true lasting change. Over the past year, that pattern has begun to shift in West Virginia. We took deliberate steps to stabilize key aspects of the system before attempting to transform it. We have focused on consistency in safety practice, clarity in expectations, and rebuilding trust across the workforce. We have invested in strengthening supervision, modernizing processes, and aligning partners around shared outcomes. These efforts are essential because sustained reform cannot occur in an unstable system. These foundational improvements are now opening the door to a new phase of progress, one defined by innovation, precision, and more innovative use of information. West Virginia is actively exploring advanced analytics to strengthen foster care recruitment, improve placement stability, and better support children already in care. By examining patterns and data that were previously siloed or underutilized, we can more intentionally identify where foster families are needed, what supports help them succeed, and how to reduce placement disruption before it occurs. We're also examining the use of predictive risk modeling to improve decision-making and case management. This work is not about replacing professional judgment, it's also about strengthening it. By equipping caseworkers and supervisors with clear insight into risk, trends, and system pressures, we're enabling earlier intervention, more focused support, and better outcomes for children. These changes matter because they shift the system from being reactive to being proactive. A stabilized workforce can leverage better data informs better decisions reduce unnecessary system involvement, and improved outcomes for children and families. Progress begins to compound rather than stall. This is how exponential change occurs, not through a single reform or a single piece of legislation, but through aligned efforts that reinforce one another over time. Real progress is built when policy, practice, technology, and workforce supports move in concert, creating a system capable not only of change, but of sustaining it. Lastly, I want to thank our staff. The people doing the work are dedicated in achieving our mission of better outcomes for children and families. More importantly, these are the individuals who have and will continue to facilitate the change we have begun to see within our system. They are the ones who will sustain these systematic reforms and continue to advance child welfare in West Virginia. As the governor highlighted, West Virginia's child welfare system is still on a journey, and more work is ahead. But today, we are no longer building on sand. We are affirming a foundation capable of supporting innovation, accountability, and continuous improvement. We will remain focused, grounded in strong practice, supported by modern analytics, and centered on relationships with families. The pace of change will continue to accelerate, and the system we build will be stronger and more responsive to the children and families it exists to serve. Thank you.
Great. Thank you.
Thank you, sir.
All right. Well, we appreciate everyone coming today. I do want to recognize some of the elected officials. I mentioned Kevin Bartlett was here. Senator Bartlett's doing a lot of outstanding work, and I know this is an issue near and dear to your heart. We have the Judiciary Chair, J.B. Akers. Thanks, J.B., for coming here. And we have Delegate Howell, who's a very diligent delegate, always looking out for constituents. So we appreciate the interactions and the working relationship with a lot of the key members of the legislature, and we've been having a lot of good discussions about these issues and others lately. So appreciate you giving that update, and now I'm happy to take any questions that you may have. Stephen.
Yeah, you're talking about a revolving fund.
Yeah.
Obviously, you're in the beginning stages of this. How do you see that initially being funded, and how do you see it continuing to be funded going forward to be able to do what you're talking about?
Well, we want to work with the legislature on some of those details, but what we envision is we know that we're paying a lot more every time we send kids out of state. You know, if you look at that number, 156,000, if you could bring them in, at least some portion of them initially, let's say you could save 10% of the dollars up front. The object is to come up with a formula to be able to, as we're putting money into the infrastructure, the building out of the state facilities, the renovation, the repairs that are needed. As you're doing that, on one hand, that's a cost item, but if you can start to move more kids back to the state, you should start to see some reduction in the total number of kids that are expending it at that $156,000 rate, approximately. So that's the goal. We're trying to think through how we take advantage of the savings that are going to get generated by bringing people home and use that to continually invest in the facilities, repair and renovation.
A quick follow-up question on that. So that 156,000, that is...
That's approximately.
That means that per...
On average. I think that's for the 390 kids.
Okay,
Yeah.
Thank you.
Absolutely. Amelia?
A follow-up to that, I mean, yes, there will be savings if we bring kids back.
Sure.
But those are not going to be available immediately. So will this be a line item that you would put in your budget proposal? Like what, if there is money needed up front, where would that come from?
Actually, there will be money up front because you're exactly right, and there will be resources. Right now, we're looking at approximately $6 million as a starting point. That's going to allow us to rehab and renovate and be very helpful. And, you know, we don't want to talk about specific facility areas because, you know, we want to negotiate effectively, and that makes a big difference. But we do believe that there will be resources to help. And so you're right, you need to have some of the upfront dollars, and I think you'll be seeing that and many more items within our budget that comes out in a couple weeks. We have the State of the State coming very, very quickly. And so I know that those items will be spelled out.
And you anticipate that $6 million being state funding?
Yes. Question?
How do you ensure public accountability? I don't normally cover the child welfare beat, but in my years of working here and dealing with cases, I've had trouble getting information about children starved to death, frozen to death, 5 murdered.
Sure.
And those are only the cases that come to our attention. How do we know that day-to-day operations are working if the release on information is so tight that sometimes you all can't even get it?
Well, I think one thing, Bob, that you have seen, and regardless of how people grade what we're doing, there's been a new era of transparency that we've provided so much more information than what people have seen in the past. And so we have a dashboard, we have a lot of information we're trying to get out there. There have been a lot of public meetings where we're trying to address a lot of the questions that are coming in. But I think we talked about it. We changed some of the programs earlier this year to facilitate additional release of information. I think that's important, and we're going to keep doing that. You're right, we're subject to some of the federal rules and other provisions that limit what we can do, but what we did earlier this year is we did a comprehensive review, and we changed things a lot, right? And there is a lot more transparency now than there's ever been, and we want to continue that, obviously, while also protecting the confidentiality of these kids and their families. Ma'am?
Yeah,
And what's your name?
Maddie Sperling, 13 News, I'm new.
Great. Nice to see you.
Nice to meet you. All of these new initiatives, either current or planned, will any of them be aimed at young adults who recently aged out and are adjusting?
You want to take that?
No, I appreciate the question. So yeah, I would say we're continually looking at all different areas to, improve outcomes for youth, particularly those aging out. There will be an announcement or a release here shortly to address that issue specifically and help really employ or reach out to providers to help improve that work. So there'll be more to come here shortly on that to help get more providers involved in that effort, because we do know it is very important.
So currently in the plans for the revolving investment fund, is that a priority in the revolving investment fund?
I think it's one piece of it. We're going to look at all of these issues. To the extent that it involves bringing our kids back home, we're looking at all the components of that. And so, we don't have the detailed legislation for you today, but I've had some conversations with some of the legislators already about that, and I think there's an eagerness on the part of the legislature to work on that and to be very thoughtful. I think that's going to be a good area of consensus that we have with the legislature this year. But those details will come out as we get behind consensus legislation, things we're already talking about now.
And then one last thing is, for the revolving investment fund, will there be an initiative to recruit out-of-state specialists, like child development specialists?
Well, I can tell you this, yes, there's always going to be an effort to recruit out-of-state specialists and to grow the capacity of our provider network, and that occurs both here within the child welfare system, and then we have a very aggressive plan separately for a rural health transformation fund, where we submitted our application a while back. That recruitment, retention, retraining is very, very high on our list. So it's always our goal to keep growing our workforce, growing our expertise, our level of specialization, and this is no exception. Other questions that you may have? Aaron.
Okay, so relatedly, it sounds like there may be more information coming out, but I want to be sure to get these questions answered. Mount State Spotlight's investigation published this morning revealed that over more than a decade, West Virginia has sent $7 million back to the federal government that could have helped kids in our foster care system with education, job training, rental assistance, and other needs referred to as CHAFE funding to help them transition to adulthood. Your Department of Human Services told us...
Can I ask you, who are you reading? Are you reading an article from some reporter that wrote it? Are there sites for that? It'd be nice to see.
I write my questions in advance so that
Okay.
I don't, mess it
Sure.
up. Okay. Your Department of Human Services told us they are going to stop this practice. Will you personally promise today that as governor, you will ensure that all of the federal resources available will be used to help these foster kids rather than being sent back to Washington?
I will tell you this, we try to be good stewards of the taxpayer dollars, and so we try to be very careful to spend money in the most cost-effective manner possible. That applies to both state dollars and to federal dollars as well. And if we think that the federal dollars can help the state of West Virginia, we're not only going to use them, we're going to try to spend those monies very carefully as well. So, if we ever go through and conclude that there's waste, then there's waste. So what I will say to folks is we're going to be really good stewards of the taxpayer dollars always. And certainly if there are dollars available that could help people, we're going to use those dollars. Question?
Yeah, you mentioned drug use being a player in this situation.
Yeah.
And as you know, President Trump did announce yesterday that he wanted to
Absolutely.
order that would weaponize fentanyl. How does that play into this? And will that be discussed in the legislature?
Look, I think that that's a really big announcement, and I know that that came out a little bit later in the day. I think I saw something coming out at about 4:03 that when you list fentanyl as a weapon of mass destruction, what it does is it changes the messaging about the level of commitment on the part of the federal government of how we handle fentanyl. Fentanyl is a very dangerous substance, illicit fentanyl, I should say, very dangerous substance. That's why, as Attorney General, I spent years pushing this very policy, working and leading with many other attorneys general to try to get this change announced. So I think whenever you can dramatically reduce supply, it matters, right? And it reduces some of the incidents that you see on the ground. So I'm very encouraged by it because to tackle the drug epidemic, I've always thought you have to be focused on three prongs. Attack it from a supply, demand, and an educational preventative perspective. So President Trump's announcement really goes after some of the supply, and I applaud it. And you may remember, for those covering, that on day one, we announced that was an important priority for the state, and we had asked our fellow federal delegation for support. I applaud their efforts supporting this and many others. So I think it's very positive. The more we reduce supply, the better off for the state. You're welcome. Stephen.
One question about PATH. Obviously, it seems like so many of the paths, no pun intended, for DOHS go through PATH, including foster care, CPS, child
Sure.
welfare. And either of you can answer this question. I know you're on the record, Secretary, being very much kind of frustrated with the PATH system. Short term, you have to work with it.
Right.
But long term, I mean, are you all looking at changing this, doing something brand new? I mean,
Yeah.
anything new you do is going to cost probably as much as it costs to put in PATH in the first
Sure.
place. But there are so many issues that seem to be popping up all
Yeah.
over the place, including delayed payments to some providers that's causing some issues.
Sure.
So what are we looking at long term
Sure.
for this?
No, it's
system that you all inherit?
sure. No, it's a good question. And what I would say is that I always challenge our team to be able to look and to have the best possible technological tools that are available. And if certain tools aren't working effectively, you look at alternatives. And that's something that occurs every single day, quite frankly, for every technology. Technology generally, through the use of AI, is changing literally every single day. You look at some of the updates on Grok and some things, and AI and the intelligence levels, there's so much that's moving so rapidly. So I would say that we always want to be looking for improvement in this area. And you're correct also, though, that a lot of it depends upon the nature of the contract, that you might have some long-term contracts. So I'm not here to make any big announcements today, but I will say that we're always going to be looking to improve the tools, and if there have been problems with some of the systems in the past, they usually move to the top of the list, and so I would anticipate that, and I'm just optimistic that through the growing improvement of technology, we have the ability to be even more effective, and I'd like to see that ultimately lead to cost savings for the public at superior results. Amelia.
I know that one of the things that you're supporting from the legislature is this fund for bringing kids
Sure.
back in state. We also saw about 15 other pieces of foster care legislation.
Yeah.
You rolled out there, and there was maybe a question for either of you. Are there any other bills that you're interested in backing? Specifically, I'm interested in ones about CPS, requiring them to wear body cameras, using AI to help them. Is that something either of you have thoughts on?
So I would say this, we're in the process of finalizing our legislative agenda now, and we look forward to working with the legislature on a lot of different issues. We probably will be coming back to you with another set of initiatives, I think probably fairly soon. Could be, do we have a date on that? I'm not sure if we have a date on that yet, right? But probably before session, we'll have another list that we'll bring before you. But we wanted to bring this out today because we thought it was important to do. But we're not done yet. There's a lot more work that needs to be done with respect to CPS and foster care, and you should expect a lot of collaboration with the legislature on that issue. Any final questions? How are you, Lori?
How are you?
Good.
My question's about SNAP and the soda ban that's getting ready to take effect in January. Either one of you
Okay.
can answer. When the waiver was announced a few months ago, one of the concerns we heard from retailers was that it would cost some money to implement. Just wonder what kind of technical assistance you guys have offered those and how that's going. And also, if one of the stated goals of the program is to make the state's residents healthier, how are you going to evaluate that?
Yeah. You want to take that one?
Yeah. Appreciate it. No, that's a great question. So in regards to the Healthy Choices waiver, the state team has been working really closely with the providers, or the retailers, excuse me, as well as our food and nutrition service team from the federal government. So that's the way we've been providing technical assistance and support to our teams. Our team has, really been called out for the way they've been rolling this out and working with the Retailer Association. So really, really positive progress in that regard. And in terms of the evaluation, we have a survey process that will help us go through and ensure that we're able to capture the effectiveness of this waiver, which mirrors what other states are doing to capture that evaluation as well.
Are retailers ready for this to go into effect?
Yeah, we meet with the Retailer Association regularly. So what the team has been telling me is that the retailers are on board and that there's been progress and that there's been no indication that they're not going to be prepared for that January 1 date.
One other piece I would add is that when you're looking at all of the efforts to improve the health and well-being of West Virginians, we've talked a lot about no longer having entitlement for soda, right? I mean, people can still get soda, just they're no longer entitled to have it provided. That's a big distinction. But the one piece which is really critical is that we're doing a lot here in West Virginia to lead to not only not have soda as an entitlement under SNAP, but we're trying to get a lot of the crap out of the food and to really emphasize additional ways that we can then get people healthier. And through our rural health application, there's going to be a whole section of focus on the types of foods that people are eating, how people are educating themselves to create and prepare healthier meals. So I would expect that through that process as well, in order for us to secure the federal resources through the Rural Health Fund, you actually have to have measures, accountability of what you're doing. So we're going to try to build it off of that, and that at least will address part of this issue. But you raise a good point. We want to measure more broadly, but we feel good we start to go down that road for the rural health piece. And if you read the application, you see that there has to be accountability. Otherwise, you're at risk of the federal money being taken away. Any final questions? Aaron?
Also regarding the investigation released this morning, and this may be for both of you.
What investigation? I'm sorry.
I'm sorry, the Mountain State Spotlight investigation
Okay.
about safety funding. We were given conflicting information from your agency on how much of this money the state has spent in the last 2 years. So can you tell us, have you asked your Human Services Secretary for a report on this and how much money remains to be spent in the current grant cycle?
So we're happy to dive in. I didn't read that. I don't generally read that publication. But what I do is I'm happy to take a close look and to evaluate that, okay?
Okay.
So thanks. Any other questions? Okay, last one for you, Aaron.
Okay, this is actually my last one written down. Okay, so have you asked, and if so, will you share with us now what you've learned, why the state for so many years was sending Chafee funding back? It did sound like you were familiar with at least this Chafee funding.
So I'm not going to go speculate as to how things were spent, especially before I arrived. I can tell you that we've worked through, we sit down and we have budget meetings. We go through and spend a lot of time on these issues. So I can't speak to what had happened in the past, but if there are issues, we're happy to follow up with you on that, okay? So appreciate it. Guys, I want to thank you all for coming. Grateful. Take care, and we'll see you again soon, I'm sure before Christmas.